Mittal madam, please begin.
Yes. Sorry, sir.
Mittal madam, you can start the webinar.
Okay. Just a very blissful morning, and to one and all our present over here. So I'm Miss Mittal Polaria. I'm working as an assistant professor in a school of pharmacy in a Parul University. I feel privileged my greetings to respected Dr. M.N. Patel sir, Provost of Parul University, Dr. Abhaydaram sir, Dean Faculty, Dr. G.S. Chakrabarti, Principal, Parul Institute of Pharmacy and Research, and Dr. Lalit Lataja, Principal of School of Pharmacy, and Dr. Dr. Snehal Sonani, Holistic Health Consultant, MS Ayurvedic, and PhD scholar, Gujarat Ayurveda University, Jamnagar, Gujarat, and the faculty members and my all dear students. A warm welcome to all of you. Or dignitary to grace the online national level webinar on Ayurveda concept, risk management, and emotional well-being. As we all know, in these days, these are enormous people will face a lot of stress about everything related to the education, food, and exploring a new life. And it is relied on a person and this of in we have yes, okay, and here RM from February 2014 to 2017. Practical classes of UG students of Parul Institute of Ayurveda. Madam doing research work on clinical efficacy of in reviewing in the step science of manuscript writing from Elsevier Research. Also, she had completed certified peer review course from Elsevier Research Academy. Madam has published and reviewer of the many more journals like Asian Journal of Agricultural Extension, Economy and Sociology, Plant Cell Biotechnology and Molecular Biology. Madam has also reviewer in a International Journal of Ayush case report, like a Journal of Pharmaceutical Research International, and also Asian Food Science Journal, Journal of Advance in Medical and Pharmaceutical Sciences, World Journal of the Pharmaceutical Science and Technology. Madam has also published a research paper in a national level as well as international level in a case report of role of Vita Karma in a management of Visvachi. It is a European Journal of Biomedical and Pharmaceutical Science. And the Panchadhatu Shalaka in the management of coal. It is a case study and it is a Tapti UGC Care Journal. Madam has also published several papers like and posters and or seminars like and the madam also like a national conference on necessity of dincharya in the present day by Indian Institute of Ayurveda Research and Hospital in Rajkot. Advancement in the Ayurvedic Yoga Vidhi WSR to modern and procedure. Jignasa 2018, it is a National Arogya Fair 2018 organized by the Tarunya Shiksha Seva Trust in Bangalore. And madam have many more achievements. I cannot eat by one. So, but another one is that adjuvant therapy in the management of Mansik Raja. The seminar, it is a Sammohan 2019 held at the Parul Institute of Ayurveda in the Parul University. And madam also give the paper presentation. The one other thing is that concept of Ayurvedic concept, except of diabetic foot ulcer. It is awarded as the best paper. And the seminar it is that Abhigyotna Panchara National Seminar on the trauma care in Ayurveda 29-30 December 2017 in Parul University. Madam has a qualification, like a madam has completed Bachelor's of Ayurveda in and Medicine and Surgery. It is called as a BAMS. And Sheikh JP Government Ayurveda College, Bhavnagar in Gujarat. Madam has completed Masters of Surgery in a Parul Institute of Ayurveda, Parul University, Vadodara, Gujarat. Madam have a pursuing PhD in Ayurvedic. It is the Institute of Teaching and Researching Ayurveda, Gujarat Ayurveda University, Jamnagar, Gujarat. Today, madam has taken to brief our youth regarding the Ayurveda concept, stress management and emotional well-being. Thank you so much, madam. You have to continue the webinar. So it is over to you, madam.
Yes, thank you very much for a detailed description about me and introduction. Thanks.
Thank you.
And I also want to thank Principal Ma'am, Dr. Lataja Ma'am, and other faculties from Parul University for giving me such kind of opportunity to be a part of this kind of webinar. Thank you very much. So I will start this discussion from my brief introduction that I am Dr. Snehal Sonani and PhD scholar from ITRA Jamnagar. And our today's discussion topic is based on the Ayurveda concept for stress management and emotional well-being. As we all know that stress and Ayurveda is a trending concepts of today's well-being or today's era. Ayurveda as stress, both are the very trending in today's days. As Narendra Modi is also very interested in Ayurveda field and also want to develop as much as possible for all kind of disease management and person's well-being. So first, as we talking about stress, we will just go through the stress definition or how we can define the stress. As we all define the stress as a some kind of a mental disorder or a mental disability, but not like that. We can understand stress by both aspects, a positive aspects and a negative aspect. First, we will talk about the positive aspect, that what is the stress, how it is helpful to the human being. As if it we are not taking a stress or we are not used to the stress, we will not achieve anything. So stress is useful for us to achieve some kind of a goal or some kind of a achievement. So it is a useful for achievement, as it is a marker to get something that yes, I have to do this. So stress is a good for some kind of achievement. But yes, in a negative aspect, if we will think, but it's a longs for us, it lasts for a long time in our body or human body. It can impact on a person's body as well, mood, and as well as on a behavior. So stress have a effect on a both aspects, a positive aspects and on a negative aspect. So we can define stress by evolutionary adaptation of human being that can help the human for a coping capacity with some kind of crisis or a moments to deal with it. And it's a running from ages to ages, that it's not a changes in a one day, it's coming from some eras and eras. So it's kind of adaptation that persons used to do it. So for a positive aspect it's a good, and it's a negative aspect it's a bad for a person's health system. So it's a just a natural bodily reaction. This is necessary for survival, and also it's a negative impact on a person's all kind of physical aspects on a mental and body. So we can say that it occurs on the response of some kind of threatening event, that is a danger. It can anything, that it may be the some kind of a national disaster or a war or some kind of emotional pull, or it can be some kind of our social factors. So it can be any kind of threatening event which can lead to the stress. But yes, stress can be in a both aspect, that's in acute condition and in a chronic condition. If a stress is just a event that occurs on that stage, that when threatening event is present, and after that it resolves, that is acute stage. And if it persists for a long time in a person's body, that it leads to the various kind of physical changes in the body due to the stress hormone and a stress factor. So how it affects to the particular body depends on the balance that person is doing for the demands and its ability to cope with that demand. So it's variable to person and person, that some persons is affecting for the stress very at a high level, and some persons at all not worried about stress, or not very cool and calm. So it depends on the person's prakriti, or we can say that person's physics, all over physics, which defines that what stress level in particular person's body. So just nothing else but just the balance a person is doing for the demand, that particular goal or activity, and it's or his or himself's ability to cope with that demand. If he's able to do that demand, or able to fulfill that goal, then yes, it will not suffer for stress anymore. But yeah, its goal is very high and he's not able to do that do for that goal and achieve for that goal, will definitely go from the stress. And other factor is its body physics and body elements, that how it goes through, and how it's support for a stress management, and how it is useful for a stress tackle, how we can tackle the stress. So when there is a factor which cause the stresses, it's called as a causative factor for a stress. So it can any threatening event, as we talked, any kind of threatening event can lead to the stress. But in phase to perceive the threat, sympathetic system of our body will flood the body with a stress hormone, that is cortisol. And cortisol will run throughout the body. And yes, definitely we cannot say that yes, in a particular this type cortisol will recede. So in all over the body cortisol will go, and definitely cortisol will impact his effect on all over the body. So we can get symptoms of stress in all over the body. So if we want to judge how stress is occurring, or how we can go through the stress, we just go for major causes of stress, that is causative factor of stress, and a stressor. As we all know that what is a cause which can cause the stress, or which can elevate the physical our disability, that can lead to the can define as a major cause factor of a stress. Here one terminology is stressor. How we can justify stressor? Here stressor is the factor which can elevate the stress level in that particular person in the presence of a causative factor. So if person is a very low at a stressor level, if person have a very low stressor factor, then yes, definitely he will fight to the stress and we will manage at his own. But yes, person is having a very high level of a stressor factor, definitely suffer from the stress, and also will not able to cope up with that stress, and cup coming through the from the stress factor. So we can define the stressor as various kind of physical habits of our daily routine. Thus, one person is not taking proper nutritious diet, it can also lead to the various kind of physical changes. We will talk it later. And also too much intense exercise, it leads to the various kind of wasting in the body and protein dilution in the body. So it can also lead to the stress factor, elevation of a stress, and also very kind of a laziness throughout the day. Calorie imbalance, that is unnutritional diet and not enough sleep, can also lead to the imbalance in the mind mental status and food sensitivity. And comparing yourself, always some person is comparing with other, that yes, I am like that and I want to be like that person. That comparison will aggravate some minute change to the stress level, or will lead to the stress very minute cause. And negative self talk, some person is talking to themselves and like that, yes, I am not able to do this, he is very doing very well, and why I am not doing so, yes, I am not able to do that, I have not such kind of strength to do that. That kind of negative self-talk can also lead to the stress. And perfectionist mindset, that someone is thinking that I should be perfect at all the time, even he is not able to do that particular things. He also think that yes, I will do it and I will do it very perfectly. If he is fail, he will fail for that some do that thing for perfection, he will feel the stress factor, or will feel the stress. So this kind of stressor in the body will lead to the higher stress factor in the body. And as we see that in the changing era, by era and era, we will see the graph that stress factor in the adult as well as in the children is growing up day by day. So in adult, as we all know, that all the factors we need for our survival is money and healthy life. So any kind of changes in the healthy life, it may be social and it may be physical. And money related economical pressure can lead to the stress aggregation, that is work pressure, that I should be perfect at my workplace, that can I get a promotion, or kind of a debt to the close people, that can lead to emotional pull. And also relationship challenges, and also money crisis and money worries leads to the adult in adults specifically stress. And in children, we can observe the stress in such kind of a bullying, that social pressure, that yeah, your friend is doing well in your class, that you should also do such kind of things, so you should also such kind of events and study events. Pre-exam preparation or pre-exam timing, we can also see the stress in the children's. And yeah, definitely a major factor in the children's stress is a parental divorce. As per the various kind of research, we found that in a parental divorce, there is a huge amount of stress in the particular children. So this is a stress aggregator that can be defined by a cause and a stressor. That how stress affects on the body, as we talk that cortisols go on the all the body and mimic like some kind of symptoms in the bodies. So it is not definite that we can say yes, people is suffering from a stress by these symptoms, but it's a bunch of a symptoms, bunch of a physical symptoms that can we say that yes, a patient is suffering from a stress. And also in a such kind of acute episode, just hypertension and tachycardia we can observe in that particular person. But in a chronic stage, when person is suffering from a state stress from very long time, patient will suffer like these symptoms. All kind of symptoms will we get during the presentation of the patient. We will start from the head, that we will think that is a mental disorder, not like that, but it's a physical impact of a stress from on the head, that patient will suffer some kind of mood swings or a depression, anxiety, lack of interest, he will not interested to do anything, like of a lazy appearance, and cannot concentrate on the any kind of events. That kind of symptoms we can see in the stress patient. In a heart, we will always advise that heart patient that don't take stress, because major disease that occurs due to the stress, that are the dyslipidemia, that is cholesterol disease, and second one is a diabetes mellitus, that non-communicable disease and autoimmune disease, which we go through due to the stress in recent time or recent era, because we are not dealing with stress as we are dealing with some other physical diseases. So we should focus on the stress as we are focusing on the physical disease. As we get some minor scratch, we will go to the hospital and will get rid of that scratch in a minor case only. But we will neglect all kind of mental instability, such kind of stress, anxiety. We will not worried about that. That we will, it is a normal. We will deal with it. Not like that. Minor symptoms also of a stress with a long duration also lead to such kind of a major disease. So we should focus on the such kind of mental conditions also. So in a heart, it leads to the high blood pressure, tachycardia. Also, there is a risk of a heart attack, and also this I told dyslipidemia. In intestine, it is said that such kind of IBD, that is irritable bowel disease and syndrome, may due to the stress only. So it's we can say that stress leads to the many kind of events and a bunch of a disease. So it's also impact on a intestine. In a reproductive system, infertility is a main effect of a stress. We can see in a recent era that IVF is so trending due to the stress and infertility. So testosterone level will decrease and estradiol production also muscle will feel lazy, restlessness, and also kind of very pains and act in the all over bodies. Immune system will go down, and also disease which occurs due to the low immune system will be manifested. In a pancreas, yes, it leads to the high insulin level and will finally deals to the diabetes mellitus. In stomach, we can see that reflux disease, that is acidity, hyperacidity. It's also due to the stress factor. We can observe that in such condition of a stress, patient will suffer from this kind of reflux disease in more cases. So this is due to the stress factor. Yes, stress can also affect on the skin. Stress level and cortisol will decrease the secretion of a sebaceous gland, perspiration. So dryness of a skin will lead to the acne and psoriasis and other kind of skin disorders. So this all kind of manifestation will due to the chronic level of a stress in the body. So as per the Ayurveda, this is the three baseline or a base aspect of a bodybuilding: dosha, vata, pitta, and a kapha, which is very necessary for the body functioning and its maintaining. Physical as well as all kind of functioning is necessary. These three dosha. So there is a description that what kind of stress effect on particular of that dosha prakriti person. That if a person is a vat dominant prakriti, it manifestation of a stress will occur like a greater anxiety and a worry. And also that patient of a vata dosha will tends to self blame, like I am the only responsible for this event. Like self blame is more dominant in the vata prakriti. And in a pitta prakriti, some kind of a skin disorder, that is acne, rash, eczema kind of appearance will see. And also there is changes of a hypertension. And in a pitta prakriti person, stress will defined by the tending to the find out the fault from the other people, that I am not responsible, you are the responsible for this event. So that is a presentation of a pitta prakriti dosha in a stress condition. And in a kapha prakriti is a even tempered and anxious patient. When there is a condition of a stress or like a threatening event, so even tempered, he will not show his mental instability to other. That's I'm okay, like that appearance in a kapha prakriti, and he will withdraw from that condition. That's I'm not able to do this. So that's kind of features we'll see in the kapha prakriti persona. Such status of well-being as Ayurveda aspects for all kind of well-being. That's only physical well-being. It's not necessary for healthy life. It's all kind of well-being, as we can say that mental well-being, all kind of relationship, that it's going very smoothly. We can calm our mind, and also mental stability. It depends on the relationship. So it's also important for all our well-being relationship. Then physical well-being, that's our all kind of physics, that is all kind of systems, our GI tract and other systems well-being. It depends on the all our body well-being. If any kind of minor disease is there, we can also judge that we are not okay and we are not physically fit. So physical and mental both status are necessary, as well cultural, environmental, occupational, and financial stability leads to the status of complete well-being. So it's necessary to achieve a goal of this kind of well-being, which can lead to the healthy and wealthy lifestyle. As we are talking Ayurveda aspects for a particular stress management, can Ayurveda deal with stress? Some persons are talking like that. Yes, definitely. Ayurveda have such kind of treatment modalities and all kind of aspects put it in the text or put it in the classical textbook, that how we can manage with the mental condition, how we can manage with the pharmacological drugs, how we can manage with it pharmacological, and what can be the non-pharmacological aspects to deal with that such kind of mental conditions. So what Ayurveda says that in such cases there is a need to go slow down your mind. Like first step to deal with the stress is to get a slow down. Like we are in a very hurry in this 21st century, that yes, I need this thing or I need this goal in very fast way. So for dealing with the stress, or if you want to avoid a stress in your life, you should be very slow or steady. As you all aware about, or you have here that story of a tortoise and a rabbit, that steady and slow speed can lead to the line of a winner line. So it's a steady and slow speed for to the goal, and change any events can lead to the goal achievement very perfectly. And in this speed you can also get a perfection and also get a satisfaction that yes, I had did that, and yes, it very in a very well manner. So it's a necessary to get a slow down for a management as well, and also for a prevention of a stress. And other thing is indulge in a quality self-care. We will talk about it later. Commit a daily routine, eat a supportive diet, supportive Ayurveda herbs, and a fit mind and body organism. We will talk it one by one. First, as we talked about slow down, that slow, simple, and gradual approach to change. Any kind of change need a slow speed or a kind of a gradual approach, that it not occurs in a one day. One should take a time for some kind of a change and some kind of a goal achievement. So first thing one should do for stress management is to slow down. So it's a supportive and also it's a kind of a perfection to get something. Some other thing is indulge in a quality self-care. Ayurveda has mentioned many kind of modality, but first of all, in the introduction chapter, Ayurveda has mentioned dincharya and a ratri charya, that one particular healthy person should do in a daily basis, the dincharya and a ratri charya. It helps to rejuvenate your cells and a tissue to cope with all kind of events going surrounds you. So first of all, we can do such not all dincharyas, as we are very busy, going through a very busy schedule, but yeah, we should do such kind of dincharya self-care. We should spare a time for ourselves in a day to manage yourself, to try and love yourself. It's a management for some kind of a event, and also to tackle such events. It's necessary to be yourself, love yourself, to spare a time for yourself. So this kind of all procedure can lead to the self-care and also quality life. So first of all, Abhyanga, that is Ayurvedic oil massage. If you had done in a life very once, you will feel that what calmness and pleasure you will get after this Abhyanga. So it's an ancient practice of oil massage. It will calm your nervous system, as well lubricate and rejuvenate the tissues, and also promote the healthy circulation, which can lead to the ability to fight with any events, or ability to cope with such kind of events which we are going through. So Abhyang is very necessary to for a self-care and also quality of life. And practicing oil pulling, that is in all kind of our orifice, nasal and nasal, ear, eye, such kind of oil can regenerate tissue and also give us a ability to fight with such kind of events, and also give our mind very calmness. Take a bath. Yeah, this is a very usual things that we are all going through. If we are very tired and very lazy we are feeling, we will go for a bath, and yeah, we will feel very freshness. So take a bath, it release the nervous system and release the tension, and also help to quit the mind from our body system. So it helps for a stress management very a lot. So it's also useful for a self care. And massage your foot at bedtime specifically, it will give you a better sleep and a sound sleep, which can also lead to the calmness of a mind. Also nausea, it's I said that applying to oil at the orifice, specifically nausea is defined for the nasal orifice. It will lubricate and nourish the delicate tissues over the nasal, and also promotes the unobstructed breathing, and also support the mental clarity, which will can lead to the ability to cope with that events. And also get adequate rest, it definitely will help for a mental calmness, and also useful for it. And read uplifting book. Yes, it's a change of mindset that we are going through. So we, if we read some kind of book, it will help us to cope with that event, and also will help us to change our mindset that yeah, this should be not like this, it should be like this. So it's a very useful for a mindset and changing our atmosphere. So reading of uplifting book. And yes, sit in a nature, it's a something sometimes it's a very pleasing experience that we, if you are if we are exposing our senses to the nature, such kind of natural smell, natural sounds of birds, and all kind of wind, and also some kind of texture seen, like a natural texture, we will get some kind of pleasure. And so in some kind of stress factor or some kind of a stress event, we should go to the natural place, sit very calmly, and just enjoy the all the natural places. So what it does, it will activate the rest and digest nervous system, and rest and digest pathway, and all the anabolic our material, that is a waste product, will go through the body and will get relaxation. So this kind of self quality care is very important for the stress prevention as well as the management of the stress. As we talked, supportive diet is necessary for immunity boost up, and also it's necessary for healthy well-being, where we are healthy to physical maintain. We will also very calm to the mental stress also. If we are suffering from some disease, we will also get some kind of mental disability, that yeah, we having some kind of disease. So physical health, proper health can also lead to the mental proper well-being. So we can define that food and mood are main tips for your mental health. So such kind of nutritious food is very important for a stress prevention as well as a stress management. It will low down the stressor factor and will get power to cope with that stress event, and also in presence of a positive factor also. And yes, plan a daily routine. As we are going to a very trouble or a troubleful and very hazy lifestyle, we are not following a one pattern or one daily routine. As we can see that plants and some birds and animals are following patterns of the all environmental changes, that some plants are giving flower in some seasons only, some reproduction time of that some particular animals are in some seasons only. So they are following some kind of a plan or a daily routine to the according to the environment. But we are very modified, or we can say that we are in a 21st century, so we are planning our daily routine according to us. So what occurs to our physics, it is not get used to that daily planning, as we are changing our daily planning very in a daily basis. So it is not used to that particular stick planning. So what we should do, make a daily routine and also try to stick that daily routine, and make a routine that you like to do. So what happens, that our physics and body physiological factors will use to do that and will change according to that. So some kind of major events in the body will not hamper that kind of our physiological changes, because it is very stick to the that plan, and it has to do like that only. So we have to make some plan on a for a daily routine, that it should include some kind of exercise, it's a reading of book, and also make a do list that yes, my wish is like that, and I will make effort for fulfilling that do list. So and some kind of a routine household things also help to divert your mind, like that you should make your bed. I'll also prepare for a dinner, or make a budget that you can plan accordingly, or nutritious breakfast, whether just like this that you can do in the daily time, and according to you that what you like to do, that you should make a daily planning. Yeah, some kind of Ayurveda herbal medicines are tends to be very effective in stress factor specifically. It's used, it is told in a research papers and research field that this kind of drugs, that is Brahmi, Jamasi, Ashwagandha, lemon balm, Tulsi, lavender, kava is very effective for a stress. It's a experimental as well as clinical study was found that these drugs are a stress reliever in the body. Cortisol level will decreased by assumption of this medicament. So yes, definitely if patient is suffering from a chronic stress level, we can say that patient should take such kind of medicament on a daily basis. It's not a harmful, because it's also a medhya rasayan according to Ayurveda, that can improve the mental stability and mental health as well. So this kind of herbal medicaments are also useful for the stress management. As there is a trend in our old men that one should take leaves of 1 and 2 leaves of a tulsi on a daily basis. This is for both kind of aspects, so physical well-being, because a tulsi is a very good antibiotics and anti-inflammatory as well antioxidant property drug, and also will help for mental stability. So one should take tulsi patra on a daily basis, as our old people are saying to us that. So it's a not a trend or a myth, it's a kind of logic that's behind that we should take this kind of trends in a era to era. Yeah, quit body and mind organism, that's its settlement or tuning between mind and body, because such kind of events, if mind affects to the physics and physics affects to the mind, it will presentation will occur on a both side, mental and physical. So if we do break mind and body organism, some such kind of calmness and such kind of a relief we will get. So we will get it through the pranayam, as we all very much aware about this pranayam. Yoga and also meditation will help us to relieve from this kind of mental instability and mental stress. So this is very much useful for such kind of events. And yes, how we can if we are suffering from a stress, and yes, definitely all growing from the stress at any stage of our life. So how we can resist it, we are not taking any kind of medicament, and though we will want to resist it. So this kind of event that can strengthen your physical health and lower the stressor factor, and also give you a strength to tackle that event. So we should do a regular exercise, that according to our physics, not too much and not too low level. And healthy diet, yes, definitely it will help our nutrition, it will promote our nutritious level and also immunity. And low level of coffee caffeine in our body, because it promotes or it stimulates our nervous system. So lower stimulation leads to the mental stability. As in such case, if a tiredness, it's okay to take this. And smoking, alcohol, tobacco, it's also hazardous, that it can lead to the stressor factor. And yeah, definitely enough sleep is very important for the stress management. Yeah, thank you.
was really amazing webinar. And hello.
Yes, ma'am.
Thank you so much, madam. It was a very informative technical session. If any participant have any question, they can box. And
Hello. Yes, ma'am. Am I audible?
Yes, yes.
Ma'am, we all know that what is stress and all, but in Ayurveda we genuinely talk about the five doshas which is present inside the humans, which is almost related with all the disorders. So, can I know that how we can relate stress with that five types of doshas?
Yeah, actually, there is not five dosha. There is three physical dosha and three mental dosha. That is Vat, Pitta, and Kapha, and three mental dosha as a Sattva, Raja, and Tama. According to Ayurveda, as we talked, that it is necessary for bodybuilding and physics of our body. It's not necessary that all kind of vata dosha prakriti person and pitta dosha and kapha dosha prakriti will lead to the stress factor. But yeah, we can say that in a rajas and tamas prakriti person, that is a mental dosha, mansika dosha, it can lead to the more aggravating stress. That yeah, one person same, we will stand by 2%, that same causative factor towards that 2%, but one will feel very high level of stress and one will feel very low level of stress due to that predominant mansika dosha, that one is from the rajas or a tamas dosha and someone is from a sattvic dosha. So sattvic people will feel that kind of stress in a very low manner. Otherwise there is a high level of stress, but he is able to cope with or manage that stress, so there is no any physical changes in the body in that particular sattvic person. But in case of a rajas and a tamas person, there is a high level of stress and they are not used to that stress and will not able to cope with that stress because of, I told, that stressor factor. Because in a rajas and tamas prakriti, that daily routine and daily physics also like that they have not kind of that daily routine that is following or helping to cope with that stress. So it's definitely according to dosha. And according to vat, pitta, and kapha, I had already told that how manifestation of a stress will occur in that particular physical dosha.
Thank you, ma'am.
Yes, ma'am.
Am I audible?
Yes, yes.
Thank you. It was a very nice session.
John.
I have also one question.
Yes, ma'am.
How we will identify that which type of prakriti we have, whether it is
Yes, ma'am. Actually, there is such kind of symptoms given in a text that particular prakriti have like these symptoms. But in a brief, I can say that in a vat prakriti, patient is very talkative, very dry skin, or hair is also very thin and very rough. In case of a vat prakriti, in case of a pit prakriti, this is a very brief description because I cannot say in a detail. So as text has described all the symptoms according to the prakriti, it's a very big list. And there is also one kind of a prakriti pariksha. As we are going through the examination of that particular patient, there is one indication that we should do a prakriti pariksha of that particular patient, so we can plan treatment accordingly. So in a vat prakriti, like that symptoms. In a pit prakriti, having a short diameter and redness of a skin, very lean and thin skin, very high level of perspiration, and some kind of very symptoms of hyperacidity or a very kind of ushna guna in a pit prakriti. In a kapha, very very calm and cool, and also brain power or gaining power is very high in a kapha prakriti. And also kapha prakriti patients is kind of, we can see that very slow at any event, in any kind of event, it's a slow. So this is the primary, we can differentiate patient that it is vat prakriti. Yeah, it's not like that patient is only on a one prakriti. It can be a combine, like patient having vat and pitta both are simultaneously. but there is a dominance that in that person Vata is dominant and Pitta is not too much dominant. But yeah, both Prakriti can also along with that in that particular person.
Thank you, madam. And madam, how we can manage, or we can what we can say that how to control our diet? Suppose, see, if suppose in morning we are we are not waking up early, and then we develop stress.
Yeah, ma'am, definitely. Yes, definitely. I told that Dincharya, which is mentioned in Ayurveda, as there is mentioned that one should wake up early in a Brahma Murta, and one should go through this and this event on a daily basis, and it should be very unique that you should go through this event on a daily basis. That your mental status and physical status will like that stick to that and used to that program only. So you should go to this program only on a daily basis. And about food, there is description that according to season, that in a as we all are suffering from a very craving for a food in the winter, so we should take a very high diet or a very heavy diet on the morning in the winter specifically, as mentioned like that in particular season wise we should take a breakfast or we should take a food. So it's also like description that in a summer we should take a very low and light diet. In a winter we should take a very heavy like घी prominent diet जिसमें घी ज्यादा पड़ता है वैसा वाला diet. So it's like according to season that what should we take in that particular season.
What do you, Mittal?
Yeah. Like if person have a stress and their imbalance in diet, like food का कोई टाइमिंग नहीं रहता, कोई 2 बजे खाता है, 3 बजे खाता है, या फिर कोई पर्टिकुलर टाइम नहीं रहता, जैसे कि मॉर्निंग, इवनिंग एंड आफ्टरनून ऐसा, तो इट विल बी इम्पैक्ट ऑन द पर्सन्स बॉडी एज वेल एज वेट. इट इज पॉसिबल फॉर दैट?
डेफिनेटली. देखो आप जैसे कि कोई भी बॉडी पैटर्न है फूड की या तो डाइट की, हमारा फूड का डाइजेशन डिपेंड करता है हमारा अग्नि या तो मतलब जिससे हम डाइजेस्ट करते हैं, डाइजेस्टिव पावर, जिसको हम आयुर्वेद में पाचक अग्नि बोलते हैं, जिससे हम मॉडर्न में बोल सकते हैं HCl सिक्रेशन वगैरह. अब ऐसा तो नहीं है कि जब हम फूड खाएंगे तब वो सिक्रेट होगा, उसका टाइमिंग फिक्स रहता है कि भाई बॉडी का टाइमिंग, जैसे मैंने बताया ना कि हमें कोई एक स्टिक टाइमिंग से जुड़े रहना रहे. जैसे कि हम रोज 12 बजे खाते हैं तो हमारा HCl सिक्रेशन उसी टाइम पे होगा. अगर हम 12 बजे को स्किप करके 2 बजे खाना खाएंगे तो डेफिनेटली वो अनडाइजेशन होने वाला है, और इनडाइजेशन की वजह से जो रेसिड्यूअल बनता है जिसको हम आम बोलते हैं या तो वेस्ट प्रोडक्ट बनता है, वो बॉडी में ज्यादा बन जाता है, और जिसको हम ऑक्सीडेटिव स्ट्रेस बोलते हैं. अभी जो ऑक्सीडेटिव स्ट्रेस बॉडी में है उसको कंपेंसेट करना मुश्किल है, और जो ऑक्सीडेटिव स्ट्रेस है वो जो बाकी बॉडी टिश्यूज की नॉर्मल फंक्शनिंग है उसको भी हैम्पर करता है. तो डेफिनेटली हमारी इम्यून सिस्टम एज वेल फिजिक्स जो ऑल ओवर बॉडी का है वो हेल्प करता है जो भी मेंटल और फिजिकल कंडीशन है उसको ओवरकम करने के लिए. अगर ये सारी चीजें प्रॉपर नहीं है तो डेफिनेटली हम उसको ओवरकम करने में हमें मुश्किल ही रहेगी. तो डेफिनेटली टाइम, बिना टाइम के डाइट को मैनेज करना एंड उसकी वजह से जो फिजिकल स्ट्रेंथ हमारी रहती है वो डिमिनिश्ड होगी ही होगी.
Okay. Thank you, ma'am.
Yes, welcome.
So shall I continue then? And as a token of appreciation, I would like to felicitate Madam with the e-certificate on behalf of Parul University. So please accept it.
Yeah, thank you, ma'am. Thank you very much.
Feedback form link, and all of you need to fill it as soon as possible. And thank you everyone present over here, and it's all in all. Thank you again, madam.
Yeah, welcome.
So other candidates should be leave the webinar.
डिस्कनेक्ट हो गया मैम, है ना?
Yes, ma'am.
कोई नहीं,
हाँ,
कंक्लूड।
yes, ma'am. एक बार वो बंद कर दूँ ना, फिर उसके बाद